السلام عليكم يا شباب. The second lecture about introduction of orthopedics. بالمحاضرة السابقة انطيناكم فد simple introduction about the fractures, healing of fractures, okay, and the ways of fixation, hold, stabilization and exercise rehabilitation of fracture. هنا بهاي المحاضرة اليوم راح ننطي complication of fractures. Complications of fractures عادة نقسمها yearly and late complication. Yearly complication including vascular nerve, compartment syndrome infection, fracture blisters. And late complication including the delayed or non-union, malunion, avascular necrosis, growth disturbance, and stiffness, complex regional pain syndrome, and osteoarthritis. Okay. Yearly complication arise during the first few weeks, including visceral, vascular, or nerve injury, which may be happened during the surgery, during the trauma itself. Visceral injury, such as pneumothorax, rib fracture, bladder injury, pelvic fracture, about 10% of pelvic fracture, especially the high velocity or high energy fractures, which is including lateral compression fracture, carry risk 10%. يعني من كل 100 مريض 10 يصير منهم pelvic injury. Require urgent treatment during the surgery. You know, the rib, including the lungs and the pleura, any fracture ممكن يسوي لنا trauma to the pleura, bladder within the pelvis. Okay. Vascular injury. Arteries may be injured during the initial injury or afterward by the bone fragment itself or during the surgery procedure. Arteries may be torn, compressed, cut or contused. Many type of injury. بس مرات الادفنتيشيا لا مرات complete cut مرات يصير sac اللي هو false aneurysm. The injured limb is pale, cold, partial. طبعا هاي شغلة مهمة انه احنا نتأكد اول ما يجينا fracture اول ما يجينا كسر لازم نتأكد انه هل هناك vascular injury لان this is vital. اوكي اهم من الفراكتشر نفسه انه اكو vascular لان تعرفون blood supply of the fracture. The fractures around the elbow, knee can lead to injury to the great vessels. Many type of vascular injury may happen with a fracture. Like around the elbow and around the knee, because of the soft tissue surrounding these two joints is so strict, so tight. So any trauma fracture may be injured those two arteries. Okay. Nerve injury. Common following the fractures. For example, humerus. Injure the axillary nerve or radial nerve. Axillary in the surgical neck. Radial nerve within the distal part of the humerus, which is notorious. Notorious is something is with a bad reputation. So, fracture humerus may be injuring the radial nerve. Enclosed fracture nerve injury is usually transient, recovery within 3 to 6 months, which we call neuropraxia. We have 3 types of fracture of nerve injury. We have neuropraxia, we have the exonotemesis, and we have the neurotemesis. Neuropraxia, the most simplest type, which can be treated with weight expectant, or let's say conservative treatment. In open fracture, the nerve is usually completely cut. Repair is a must. Documentation of the nerve status in the necessary before and after trial. Okay, انت ممكن because of your reduction you injure the nerve. Okay, and وإذا انت هو injured وانت سويت reduction بدون ما تفحص, they may blame you that you are the cause of. So check it before the reduction, close reduction. We have the compartment syndrome. We are still in the early complication of the fracture. Compartment syndrome is defined as a group of muscles surrounded by a deep fascia, in which the normal capillary pressure is about 10 millimeter mercury. In some conditions, this pressure is increased due to swelling and leading to impedance of capillary blood flow. So انتبهوا لكلمة capillary blood flow. So the major arteries is not affected by compartment syndrome as early status. يعني أقلها للبداية لأنه يأثر على capillary blood flow. Okay. Causing ischemia and further swelling and compression, eventually resulting in crossing on the muscle and nerve. Okay. لازم احنا نعرف الكمبارتمنت. عندنا revision about the anatomy. احنا نحكي عن upper limb and lower limb. Compartment common problem, common sequelae of fracture. So we must know about this compartment syndrome, and we know the compartment of the upper and lower limb. Okay. However, nerves and can regenerate, but muscular necrosis lead to fibrosis and next contracture. يعني إذا بقى الكمبارتمنت syndrome بدون ما يصير بيه infection للمصل راح يصير بيه fibrosis muscle. تنتهي المصل without any effect.